Afternoon, everybody. I'm Edy Nacarapa, a medical doctor. So I'm going to talk about the prognosis of HIV in infected children receiving HAART and 18 years retrospective study in Chokwe, Mozambique. So only my introduction, we aim to evaluate the overall cumulative associated risk factor for HIV positive children on antiretroviral therapy. So the methods, we analyzed heterogeneously collected data on HIV-infected children aged below 15 years and enrolled at Carmel Hospital of Chokwe from 2002 to 2019. Kaplan-Meier survivor curves and a Cox regression model when we use it to analyze the incidence and the time to death. The results in 1,341 children were enrolled on HAART, 55.2 were boys. The overall death rate was 3.6 per 100% here. The Cox regression showed the high risk of death in those, a high risk of death in nearly twofold and children aged below 2 years and following inpatient regimes and receiving anti-treatment within 3 months at HAART initiation. High risk nearly threefold in children receiving stavudine-based regimes. And has a risk of death nearly fourfold in children having CD4 below 100 and children classified as WHO clinical stage 4. So the contrary, some variables was predictive factor like receiving a protease inhibitor-based regime and zidovudine-based regime on HAART. The Kaplan-Meier survivor showed that patients with CD4 less than 100 initiate HAART had high cumulative incidence of death nearly 30 after 2 years of follow. So that Kaplan-Meier showed the results that I was talking about. So in conclusion, agent below 2 years old and low CD4 and HAART is in patients in WHO WHO 4 and 3 was mainly associated with death. So it is necessary to straight HIV test and HAART treatment, improving tuberculosis diagnosis in this age, and guarantee also parent psychology was in system is necessary to reduce patient death among children. And thank you for your attention.